Hello and welcome back to the WIHS Journal Public Affairs from 104.9. I'm Paul Crutchmer. On today's broadcast, we're going to be hearing about the impact that nutrition and vitamins can have upon the treatment for COVID-19.
Yes, my name is Dr. Andrew Myers. I am located in Boise, Idaho.
And how long have you been looking at this situation that we're here to discuss today?
Well, I have been working either in the research coordination area or writing my book, Simplifying the COVID Puzzle, for about the last year and a half.
Did you expect to spend that length of time on that subject? I know I was driving to work myself last night and thinking, I can't believe that from March 2020 until September 2021, we're still on the same topic, and it seems to be in our face just as much as when it began.
I am actually surprised, to be honest, Paul. I didn't think that a virus like this could impact not only our medical system, but our society the way it has. And it is certainly shocking to me the depth of issues that this virus has brought to both the individuals, but also our society and country as a whole.
Your thoughts are characterized as easy steps to COVID-proof your life amid vaccine mandate uproar. What position, for listeners' benefit, have you taken regarding whether or not there's a legal or a moral or ethical reason to mandate something like that?
Well, I actually haven't taken a position with regards to the mandate. My position, as stated in the book, is this. We missed an opportunity early in this pandemic to educate the consumer, the public, to the value of supporting their immune system. And the power of having a healthy and competent immune system is that it benefits you independent of your personal choices with regards to the type of care you choose to embark upon. And what I mean is this. Your immune system is your first-line defense against any virus, including COVID. And research that I helped to coordinate at the University Hospital System in Cleveland, Ohio, indicated that very specifically two nutrients, vitamin D and vitamin K2, are directly related to the health and function of your immune system, especially when they are deficient. If you're deficient in vitamin D3 and vitamin K2, our research showed that you have a higher susceptibility to COVID, and you also have you generally will have a worse outcome in terms of your progress once you get the virus. These are very powerful tools. The other thing that I do know is that a competent immune system is necessary for vaccination to be effective. So whether you choose to be vaccinated or not, if you choose to move down that path, then the reality is that you need a healthy and competent immune system to respond to that vaccination, to get the most out of that vaccination. And so I am, and many physicians like me, are still in amazement. My co-author on the research and the book, we're in amazement that no one really took up the banner of talking about how to build your immune system through simple nutrition, when deficiency status in vitamin D is well known and well understood to impact COVID susceptibility. So that really is my position.
With that in mind, what you just mentioned, then how come there seems to be such a blind spot in that regard then?
Well, that's another really good question in terms of the blind spot that exists in conventional medicine with regards to nutrition in general. But in this case, early in the pandemic, we saw such a focus from the medical community, from the administration, in terms of vaccination, and to a great degree in terms of the other methods like social distancing and mask wearing that are critical to helping to manage a viral situation like this. But what really amazed me is that in addition to all of the published research that was coming out, there was a broad base, an absolute broad base of information about vitamin D, and subsequently about its relationship to another nutrient, vitamin K2, with regards to the health and functioning of the immune system, specifically within COVID patients. And we just didn't see any kind of response, and I think it has to do with the fact that basically preventive measures and nutritional medicine is not a major part of our conventional care system in the United States. And as a result, it's not considered to be a viable option when, in fact, all of the research from around the world is pointing to just the opposite.
So with that in mind, then, are there other countries in the world that have done better in that regard in terms of nutrition and vitamin K, as you've mentioned, that have perhaps created an example that maybe we should have been paying more attention to here in the States?
Well, sadly, the issue is that the virus has obviously affected a number of different countries. Many countries had a better and more, I would say, robust response. The UK certainly had a position that it took as a governmental body about vitamin D3 supplementation, and actually recommended to its populace that they begin supplementing with extra vitamin D as a part of their COVID program. So at least in the UK, we saw a definite response from the government. Sadly, though, we have not seen the data yet to show what kind of impact that has had in terms of COVID and the effect of the virus. But I would expect that data is forthcoming, and more than likely it will show that individuals that did begin supplementing with higher levels of vitamin D probably had a better response.
I noted that the initial response in terms of information from the federal level was the NIH and to seemingly a lesser degree the CDC. If this type of coronavirus turns out to be a fixture of our life going forward, do you feel that some of the information that you just cited will, in fact, over the course of time, take a greater prominence, and do you think people are willing to listen to it and respond to it, particularly those who perhaps for one reason or another are opposed to vaccination?
I do believe that there is a place for nutrition research in the scope of this treatment approach, and I think as you suggest, that the COVID virus may become endemic or a part of our cold and flu season on an ongoing basis, something that we face more routinely. I do believe that there will have to be a degree of reckoning with regards to nutritional medicine and how it impacts the individual. What we did see in this country is a response in terms of self-care. There's been an increase in the sale of supplements. Individuals have sought to educate themselves as to how nutrition can improve their immune system. But broadly, I don't know that we will see the CDC or the FDA take a position in terms of enhancing or increasing the amount of supplementation that they're recommending. It has not been a part of their past history, and I'm not sure that even with the effects of the coronavirus that we're going to see a change in policy and philosophy like that. I hope so, because it's an inexpensive and safe way for people to augment and support their own immune system, independent of the choice they make along that vaccine continuum. America is a country that has a number of nutritional deficiencies that are fairly broad-based and well-documented. Vitamin D, vitamin K, magnesium among them. Mm-hmm. We also know that those nutrients play a specific role in terms of enhancing and supporting immune function. So it would make logical sense that if you have a deficiency state and you can replenish or make sufficient those levels, that individuals are going to respond, and there's going to be a positive result and benefit.
Thank you very much, Dr. Andrew Myers, for being with me on this broadcast, sir.
Oh, it's been my pleasure. Thank you so much.
My guest once again today has been Dr. Andrew Myers, talking to us about the impact of vitamins and nutrition on the successful treatment and avoidance of COVID-19. For further information, call us at 860-346-1049. That's 860-346-1049. The opinions expressed are those of the participants, not necessarily those of the staff or management of this station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from 104.9 WIHS.